Good day. My name is Luis Garcia Gonzalez, and today I'll be presenting an ethical analysis of the case of Melina and Matt, titled Between a Rock and a Hard Place, an ethical analysis of medical futility in critical care. This case examined one of the most challenging situations healthcare professionals can encounter, determining whether life-sustaining treatment should continue when the healthcare team believes further treatment is medically futile, while the patient's surrogate decision maker wishes to continue aggressive care. To analyze this dilemma, I will apply Nelson's method, a structured ethical decision-making framework, and conclude with a recommendation that is supported by ethical principles and current literature. Before discussing the case, I'd like to briefly outline the objectives of this presentation. First, I'll summarize the clinical case involving Melina and Matt and identify the central ethical dilemma. Next, I'll apply Nelson's method to analyze the situation by examining relevant facts, ethical principles, available options, and potential conflicts. Finally, I'll present a recommendation supported by ethical principles and current literature to explain why I believe it is the most ethically appropriate course of action. The case centers on Melina, a critical ill woman who developed severe complications shortly after giving birth. Despite receiving multiple life-sustaining treatments, her prognosis remained extremely poor, and the healthcare team believed that continuing aggressive treatment was medically futile. The ethical challenge began when her husband, Matt, disagreed with that recommendation. He believed that there was still hope for recovery and wanted every available treatment to continue. Although both Matt and the healthcare team wanted what was best for Melina, they had very different views on what that looked like. This situation raises difficult questions that go beyond medicine alone. It requires healthcare professionals to balance clinical judgment, respect for the family's perspective, and the ethical responsibility to provide care that benefits the patient while avoiding unnecessary harm. At the center of this case, it is a difficult ethical question. Should life sustaining treatment continue when the healthcare team believes further treatment is medically futile? There isn't a simple yes or no answer. On one hand, the healthcare team has a professional responsibility to recommend treatments that are likely to benefit the patient and avoid causing unnecessary harm. On the other hand, Matt believes there is still hope and wants every effort made to save his wife. The disagreement raises several ethical questions. How should quality of life be weighed against continued treatment? What role should Matt play in making decisions on Menela's behalf? And how should healthcare providers respond when a family wishes conflict with their clinical judgment? To answer those questions in a structured and objective way, I'll now apply Nelson's method. The first step in Nelson's method is to gather the relevant facts before making any ethical judgment. In this case, Melina is a critical ill postpartum patient who is receiving multiple life-sustaining interventions, but despite those treatments, her prognosis remained extremely poor. From the healthcare team's perspective, continuing aggressive treatment is unlikely to provide any meaningful medical benefit. Because of that, they believe it may be more appropriate to shift the focus toward comfort-focused care. Matt, however, views the situation differently. As Melina's husband and the person making healthcare decisions on her behalf, he believes there's still hope for recovery and wants treatment to continue. These facts establish the central conflict in the case and provide the foundation for evaluating the ethical principle involved in the next step of Nelson's method. After gathering the facts, the next step is to identify the ethical principles that apply to the situation. In this case, four principles help guide the decision-making process: beneficence, non-maleficence, autonomy, and justice. Beneficence supports providing care that offers a meaningful benefit to the patient, while non-maleficence reminds healthcare professionals to avoid causing unnecessary harm. If continued treatment is unlikely to improve Melina's condition, these two principles may support limiting further aggressive interventions. At the same time, respect for autonomy remains an important consideration. Although Melina cannot make decisions for herself, Matt is making healthcare decisions on her behalf based on what he believes she would have wanted. Justice also plays a role by encouraging fair and responsible use of healthcare resources while ensuring that every patient is treated with dignity and respect. Together, these principles highlight why this case is ethically complex and why there is no simple answer. Once the ethical principles have been identified, the next step is to evaluate the available options. In this case, there are three reasonable paths the healthcare team could consider. The first option is to continue all life-sustaining treatment in order to honor Matt's wishes and continue reassessing Melena's condition over time. The second option is to implement a time-limited trial of therapy. This approach allows treatment to continue for a predetermined period while establishing measurable clinical goals. At the end of that trial, the healthcare team can reassess whether continued treatment is providing meaningful benefit. The third option is to transition to comfort-focused care, with the primary goal of maximizing comfort, managing symptoms, and providing emotional support to both Melana and her family. Each of these options have ethical strengths and challenges. The most appropriate choice depends on balancing the patient's best interests with the ethical principles discussed in the previous step. After considering these options, I believe one approach provides the most balanced, ethical solution. After evaluating the available options, I believe that a time-limited trial of therapy is the most ethically appropriate recommendation for this case. This approach provides a balanced solution because it acknowledges Matt's hope for recovery while also recognizing the healthcare team's concern about medical futility. Rather than making an immediate decision to either continue treatment indefinitely or withdraw life-sustaining intervention, it allows both sides to agree on a defined period of continued treatment with clear, measurable clinical goals. At the end of that trial, the healthcare team can objectively reassess Melena's conditions. If meaningful improvement is demonstrated, treatment may continue. However, if there is no evidence that continued treatment is benefiting the patient, transitioning to comfort-focused care becomes a more ethically justifiable decision. By combining ongoing communication, objective reassessment, and respect for everyone involved, this recommendation best balances the principles of beneficence, non-maleficence, autonomy, and justice. Although this recommendation provides a structured path forward, it does not eliminate the possibility of conflict. That leads to the final step of Nelson's method, anticipating and managing conflict. Even with a thoughtful recommendation, conflict may still arise. In this case, Matt may continue to struggle with the idea of limiting or withdrawing life-sustaining treatment because he remains hopeful that Melena's condition could improve. Those emotions are completely understandable and can make these conversations especially difficult. To help address those challenges, the healthcare team should maintain open and honest communication through regular family meetings. Providing clear explanation about Melena's prognosis, discussing the goals of care, and answering questions with empathy can help reduce misunderstandings and build trust. Involving palliative care or an ethics committee may also provide additional support by helping facilitate difficult conversations and ensuring that everyone's concerns are heard and considered. Ultimately, anticipating conflict is not about avoiding disagreements. It's about creating an environment where decisions are made through respectful communication, shared decision making, and a continued focus on what is in the patient's best interest. Having applied Nelson's method, I'll conclude by summarizing the key lessons from this case. In conclusion, the case of Melina and Matt demonstrates how complex ethical decision making can become when medical judgment and the family wishes do not align. While there may not always be a perfect solution, using a structured framework like Nelson's method helps ensure that decisions are thoughtful, consistent, and grounded in ethical principles. In this case, a time-limited trial of therapy offers the most balanced ethical approach because it respects Matt's perspective while also allowing the healthcare team to objectively evaluate whether continued treatment is truly benefiting Melina. Ultimately, this case reminds us that ethical decision making is about more than choosing the right medical treatment. It also requires compassion, clear communication, and a commitment to acting in the patient's best interest. Thank you for your time, and I appreciate your attention throughout this presentation. The references used throughout this presentation are listed here. Thank you again for your time.